Hello, everyone, and thank you so much for joining us today. And welcome to this module on managing challenging students. I'm Dr. Pranesh from India, and I'm excited to meet you all. Into who is a challenging student and what are the challenges we will face from them. Let us understand two ideas. This is what I call as a primer. Before we jump into the questions itself, it is important for us to understand some concepts, some premeditated thoughts that we should have in mind before we address these questions. The first idea to bear in mind is that we have to get the right mindset of a teacher. I know you are a medical educator who's probably watching this, and I don't have to tell you about this, but still, for the sake of clarity and for putting things into perspective, it is important for us to adopt the right mindset of a medical teacher. This beautiful diagram, this beautiful flow chart proposed by Professor Harden and Crosby in the Medical Teacher Journal says that a good teacher is not just a lecturer, he's more than that. In fact, there are 12 roles of a medical teacher, and of which our concerns, our important points to understand is that the role model and the facilitator. You can see there are multiple roles being played by the medical teacher or the medical educator. But one thing is being a role model for our students, being a teaching role model, being an on-the-job role model, and being a facilitator, being a mentor who facilitates the learning experience for our students. So having these two basic ideas in mind will really help us in approaching this very sensitive topic called challenging students and how to tackle them and how to really go about in reforming them into much better successful candidates. So in essence, the most important mindset what a medical teacher should have before we identify who is a challenging student is that the teacher, the lecturer, the professor should have a coaching mindset. To have a mindset of a coach is very important, is very essential for us to succeed in this area of managing challenging students. So the second idea, what I want the audience to consider is that who is not a challenging student. We think a particular person is a challenging or a problematic student, but it is more important to understand who is not a challenging student. Simply put, a student who is pushing for a positive change, who's pushing us towards a betterment of our education, or who challenges the status quo, that particular student is not a challenge. In fact, he is a welcome addition. He's a sweet surprise for us. He really pushes us to be better in our roles. And we would have faced such kind of students who are not challenging. Some might perceive them as a threat. Some might perceive them as a challenge. Some might perceive them as a source of annoyance. But in fact, those students will really help us to become better teachers. And they will really challenge, they will really question our teachings. Not because they really want us to fail. They really want the best for themselves. They really want the best for the medical community as a whole. A student who provides a constructive criticism or a feedback for the teaching is definitely not a challenge, and he's definitely or she's definitely not a problem. So we need to welcome these brilliant minds because they can in fact push us to be better educators. So we should ask ourselves, are we the problem or they the problem? When we are not the problem, when we are not insecure about ourselves, when we are confident, competent, and capable medical educators, then we shall pursue. The second question is, who is actually a challenging student and who is actually a problematic student? Now, let's define a challenging student. In its simplest form, when the student's behavior is going to be a problem or a threat to himself or herself, that is the personal part, to his or her colleagues, that means including the students and the institute, including the teachers as well. And most importantly, when the problem is going to impact negatively on the patients he or she serves. So in across these three P's, personal, peers, and the patients. And then we will consider that particular student as challenging or problematic. So now, having defined in a nutshell about who is actually a challenging student, let us move to few scenarios which will help us to understand better the practical aspects of it. Let's consider scenario number 1. Now, here is a small lecture hall or a group discussion is happening there. If the student is not going to behave well, if he or she is distracted, causes some problems, despite the class having a good atmosphere, and his behavior, if it's going to be a threat to the learning ambience, or if he's going to pose a challenge to the people around him, and then we consider the student to be problematic to his peers. That's the first thing what we consider. The problem is impacting his peers. In fact, to us, to the institute as a whole. Consider second scenario. A student who operates on a patient, but he does not want to follow up the patient. Or to be more, to make things worse, he or she is not being respectful or empathetic. Worst case scenario, being unethical to the patient. Then he is obviously a problematic student. In fact, that will threaten his license to practice as well. This is scenario number 2, where the problem is impacting the patient care. Scenario number 3, very commonly found these days, substance abuse, which can cause harm to himself and eventually to the peers, to the institute, and to the patients as well. So now just look back and imagine these 3 scenarios. You might have found some students in your classroom, in your practice, who may fall into these categories. And probably they are the challenging students for us. And now we have got some glimpse into some of the examples, and now it makes more sense for us to understand this challenge on a spectrum, to make things more easier for us to understand, because there are multiple problems, there are multiple challenges which may be there, but it makes much more sense for us to put the student into 2 broad spectrum or 2 broad classifications. Is the challenge, is it a passive challenge or is it an aggressive challenge? A passive challenge means you can wait for the intervention. I mean, you really don't have to really push the students far. You can wait, watch, observe. You can tackle this issue at your own pace. But the aggressive spectrum, on the other hand, is going to be somewhere where you don't have much time. You really have to intervene earlier to make things much more safer for us and for the students and for the patients as a whole. So in the passive spectrum, the students are generally harmless. I mean, they can procrastinate. They may not really, finish their tasks on a regular basis. They may lag behind their schedule. They may not study properly. They may underperform in their examinations. They may fail in their exams, or they may remain very indifferent or kind of very dormant in a sense. These are passive students. On the other hand, we have this aggressive spectrum, and students can tend to be very hostile or very rude towards us, towards the patients. They can be dominant. They can be like a bully. Or they can be indisciplined. They will not really listen to us. They can be a delinquent, maybe. So it's important for us to understand that these students fall into this challenges or what I call as a challenge spectrum. It is important to identify them as a whole. But again, like I mentioned earlier, it is important for us to adopt the coaching mindset, and we should never ever see them as villains. Okay, or a wolf in a sheep's clothing, but rather a white rose amongst the red ones. They may not be your favorite students. They may not be your most favorite ones, the apples of your eyes, but they just deserve our attention and appropriate intervention from our side. Now, to summarize, we have looked at the importance of adopting the coaching mindset, adopting or identifying who is not a challenging student. It is very, very important to understand who is not a challenging student. Okay, and we should understand the 3 P's being affected by the challenging student. That is the person, himself or herself. The second P is being the peers or the medical community. The third P being the patients. And please make sure the challenges is going to fall on a spectrum. Sometimes you may have a mixture of challenges. You may not really have this kind of a very kind of discrete challenges. For example, you can have a student who's very hostile and who can underperform your exams. Sometimes a hostile, rude student may score really well. We never know. So it's not a clear-cut line between these two. The margins can be blurred. But depending upon what challenges they have, it will really make us to move towards the right direction. So that's with the spectrum. So I think I've covered the very bare essentials of this topic on who is actually a challenging student and what are the challenges we may face from them. Thank you so much for your attention.